Hello, I'm Dr. Jana Singles, and I'm one of several health psychologists in the UW Spine Clinic who specialize in the treatment of chronic spine pain. Having chronic pain is a complex experience that impacts all areas of a person's life. It is a condition that does not come with an owner's manual, and many people find themselves struggling with how to cope with the changes that result. There may have been changes in your mood, activity, and energy levels, sleep patterns and relationships, employment, and even your finances. We are going to be talking today about the impact of having chronic pain, why you might be referred to health psychology services, as well as the types of interventions that are available to help you better manage this condition. Your doctor may want to have you meet and discuss your condition with a health psychologist in consideration for surgery, medications, or for other interventions. An evaluation can assist you and your doctor in determining if this is right for you now, or to assist you in preparation for these interventions. If your spine physician has referred you to health psychology to learn pain management techniques, it is because he or she understands how pain can affect your life, and that there are skills that you can learn to lessen its effect. As you likely already know, medication doesn't always help or may cause significant side effects for some people. Even if you're using pain medications, you are aware that they rarely completely eliminate pain. But there is much that you can do to help in your own healing. Because pain and what happens when we have pain is stressful, learning to better manage stressors is important. Relaxation therapies can be helpful here, and there are many important studies to show that without a doubt, it can assist individuals with the management of their pain over time. There are many ways to relax both the body and the mind, and finding the right way for you is important. These different techniques can be customized to match the individual and their needs. Even if you say that you don't know how or you can't, you can. And with a little practice, you will be able to make this work for you. Now, biofeedback is another tool to learn to relax. It is a method where information from your body, such as muscle tension, blood flow, heart rate, and others, these signals are provided back to you so that you can learn to influence it. For example, muscle biofeedback can be very useful for spine problems, since pain often causes muscles to tighten up in guarding and bracing against the pain, and this can make pain worse. Many do not even know that they are tightening muscles in response to pain. Now, before the pain, maybe you didn't need to pace your activities. You might have just worked till the job was finished, or you were completely exhausted, or you were satisfied with the job. Once a pain problem hits, pacing becomes critical. Many people with pain get very frustrated that they cannot approach work with the same speed or intensity as they did before. Maybe you still try to do it that way, but find that you end up in a pain flare or can't do much for the day after. Learning to pace with a pain problem forces us to use our brain more, to think through the task, or to set up breaks, or to rest, or to stretch, or to get help with the kinds of things that you can no longer safely do. Think of your tasks as a marathon race that you want to finish. If you burn all your energy up in the first part of the race, you will never complete it. You can learn to be the individual who paces your energy for optimal performance in the long run. Improving sleep can also be an area that your spine health psychologist can direct you by improving your sleep hygiene, which is activities and conditions that facilitate sleep. If this is a problem area for you, he or she will assist you with a personalized plan and may refer you on to your physician to discuss medications if needed.
Hello, my name is Shyla Murgain, and I'm a health psychologist in the UW Spine Clinic who specializes in the treatment of the chronic pain problem. It can be depressing, irritating, or anxiety-provoking to live with pain. Surprising to many people, these negative mood states can make their pain worse. This is why your mood is so important to pain management. Pain that continues over time acts different than pain that has only been present a short time. and even takes a different pathway into the brain. These different pathways includes pain signals going to the emotional part of the brain. This can become a vicious cycle that is hard to get out of easily. There are many things that health psychology can do to assist you in improving your mood. One of those things is to help you get back on track with your activities that you can still engage in and enjoy. We need to continue to find ways to enjoy our life, even with our pain. Pain is strange in that it feels like it demands our attention, and yet the more you focus on it, generally the worse you will feel. Trying to figure out how much to pay attention to these pain signals can be hard work or confusing. Pain might tell us to stop, and yet we need to engage in the type of physical activities that your doctor feels are right for you. It is also likely that your thinking has changed since the pain. Most people notice that they begin to anticipate pain in certain situations or start to avoid more and more activities as time goes on. Unfortunately, this can limit you greatly, shrinking the quality of your life over time, reducing your interests, your aliveness, and your social supports. Now your thinking may move towards more anxious and depressed thoughts, which only makes things worse and keeps that vicious cycle of pain going. You can learn to have more balanced thoughts again, even with your pain. Your goal is to find the way to accept what you have to accept and work with what you can work with to improve your life. Many of these same things that affect you affect those close to you. For example, feeling more irritable with those we care about is quite common when we have a chronic spine pain condition, although not something we would want to continue. Developing ways to decrease the negative impact of pain on close relationships can be a goal that you and your health psychologist address. Remember, pain will naturally affect those people who care about you. You will want to keep those relationships healthy in spite of the pain. Remember, you are not alone. In the United States, 23 million people report the presence of chronic pain. Many individuals today want treatment that looks at the whole person, all aspects of their life affected by pain. And much research has shown the benefits of these kinds of treatment on pain management and the quality of life. You are and always have been more than your pain.